Good evening, and welcome to this week's 2020 Vision. I'm your host, Jenny Fisher from East London News, and we're going to have two topics this evening. The first one is going to be Beyond Corona. Is the NHS safe with Boris? And we've got our guest is Dr Jackie Applebee. She's local GP and a very well-known and respected health campaigner. And we're going to be talking about clapping for the NHS. It's welcome, but is it enough? And Jackie will be leaving us about 5:30, and then it's down to you, dear viewer, to become a caller. Get ready with the number 0208 1234507 and phone in with your questions for John Biggs. John Biggs isn't actually going to be here because he didn't respond to our invitation, but I don't see why we shouldn't be kind and collect your questions and send them on to him anyway. So we'll do that later. But first, Jackie, welcome to 2020 Vision. And can you let us know first, have you been a GP in Tower Hamlets for very long?
I first qualified as a GP in 1991, and I've been a GP in Tower Hamlets, apart from having some time off to have my kids since then. Yes.
Right. Well, you must have seen a lot of changes. So first of all, coronavirus, did it take us all by surprise, or should we have seen it coming?
I think we should have seen it coming from the point of view that it was obviously it was discovered in China at the beginning of the year. We've really seen it coming since at least then. So even though it sort of arrived here pretty quickly after that, we should have had more time to prepare, I think.
And how has our local NHS in East London prepared for CV? Has it gone well?
I think our local NHS in East London, and certainly in Tower Hamlets where I work, has really come together and prepared extremely well in the circumstances. We've not been helped by the complete lack of preparedness by the government, who just have really, if you're talking about PPE, if you're talking about testing, if you're talking about systemic underfunding of the NHS since 2010, where hospital beds have been cut so that we don't have enough ICU beds, enough ventilators, all of that sort of thing. No, that's and in the face of that, I think we've done really, really well locally.
I'm sure we have. I mean, we've actually lost, I think, is it 10 or slightly more health workers in East London
yes.
through this infection, which is obviously a personal tragedy, and one wonders whether those deaths could have been prevented, and certainly more pain and suffering. But is PPE the biggest issue, and how's it been locally?
PPE is a very big issue. I mean, I think testing is another really big issue. But PPE locally, I mean, certainly for general practices, has been absolutely dire. And there were some hospitals as well a couple of weekends ago who are almost about to run out. And the discussion around PPE, I mean, Public Health England say that it's okay to have a bog standard surgical mask, which is the sort of thing you'd see on the TV, really, which is a paper mask, which is supposed to be fluid resistant. And that is supposed to protect anyone who isn't carrying out what's called an aerosol generating procedure. So, for example, if you're an anaesthetist and you're putting a tube into somebody's airway, that would be regarded as aerosol generating. So they are told that they need, I suppose, a higher spec of a mask to protect them. But on the other hand, we're told all we need is surgical fluid resistant masks. But those are the sorts of masks, if you're wearing them out when you're out and about, we're told they'll protect somebody else if you're wearing it from your own infection, but they don't protect you. And yet that's what we're being told we need to wear. And then there's a whole debate, and I don't want to get too technical about this, about what generates an aerosol and what generates a droplet. And the science is very much, the jury is very much still out, really. And some people say even breathing can generate an aerosol. Certainly if somebody coughs, it would generate one. And so we think the government should be erring on the side of caution, even if they don't believe, and they're not. And then the death rates in health workers. I mean, there was a study out, or some statistics out last week, which said they were more or less in line with the rest of the population, but what they weren't taking into account was age. And you can't compare sort of generally younger and fitter health workers, working age people, with the whole population. We don't have many health workers in their 80s, and we all know that the death rate is higher, tragically, in the older age group.
So that would make it higher in the health worker population once you take that age factor into account. Going on to testing, as you say, that's also a very important issue, and it's not really one that I have understood yet. I've been grappling with trying to understand what's going on with corona, but not always succeeding. And testing is one of those areas. I mean, okay, so we're going to have a lot more people tested, and then what?
Well, they say we're going to have a lot more people tested, but that actually hasn't happened yet. And up until a couple of weeks ago, they weren't even testing health workers. So they were just testing people who'd gone into hospital with symptoms who they thought might have it. So very, very, very sick people, really. So that's who they were testing. And what I think they should be doing, and what sort of health workers generally think they should be doing, is testing random samples of everybody. We don't know who's got it. Some people get very mild symptoms, so that we can't know what's happening out here in the community unless we're testing up to 20,000 people at a time to find out who's positive and who's negative. And then we'll know the prevalence of, the number of cases in the community. And if you just look at the number of people who die in care homes, I mean, the huge numbers of people have been dying in care homes. So it clearly is out here in the community. So testing would help us to understand how the disease is behaving in the community. At the moment, we don't have any idea about that.
And I suppose if we had more random testing, then those of us who tested positive would know that we had it, and we could then isolate for a fortnight or so, and then sally out hoping that with some reason to believe we wouldn't infect anybody else because we'd had it and were no longer infectious. Is that the idea?
That's part of the idea, but we don't know how this virus behaves yet. So we don't know how long people would be immune for. So we can't say that definitely. And some people say that in the worst possible scenario is that people are only immune for 3 months. But the other thing about testing is that if people test positive, then they can be isolated, but also their contacts can be traced and they can be asked to isolate. So to cut down the number of people circulating in the community who are infectious. And this is what's worked so well in places like China and South Korea. But the other thing I need to say about tests is there's two sorts. There's one that tests whether you've got it right now, and that's a certain sort of test, and that's called an antigen test. And then there's another sort of test which you can do a couple of weeks later to show whether you've actually developed immunity, and that's a different sort of test.
And to imagine the latter one is probably more expensive and takes longer.
That involves a finger prick blood test, but that would be. But the trouble is with the one with the immediate test is that if you haven't got enough. It's only positive for a certain number of days, between 3 and 5 days. So as you're sort of building up towards it, you can still be infectious, but you could have a false negative as you're building up, and you could also have a false negative as you're tailing off again.
I don't see how this testing is going to give us. It may well give the medics some of the answers and that they need and want to help work out how the disease is being managed. But in terms of public safety and ending the lockdown, I can't really see that it's going to be a huge help, at least not a quick help.
I think the only way it will help is it'll show us how widespread the infection is in the community. I mean, I don't think we should be talking about opening schools and things like that until we know what the virus is doing in the community. We can't just rely on the number of people who've gone into hospital and been tested, because at the moment we just don't know what the denominator is in the community. I mean, some countries who've gone a bit ahead of us have found, there's a study in Italy that showed that huge numbers of people had it and didn't even know they had it when they were tested randomly. We need to know that sort of information here.
Yes, because I think it might have hit Italy back in January now, don't they? And that's why it was so severe. Yeah, okay. Well, you were saying about the number of beds, and the ICU beds in particular, in Tower Hamlets. And of course, we've been on a bed reduction programme for some years now, haven't we? I mean, almost since I can remember. I think the bed reduction programme is usually called building new facilities or something like that, but nonetheless, that's the outcome. But we've suddenly got this new this new place at Excel. We've converted Excel into a multi-thousand bed hospital. So what do you think of that? Was that a good idea?
I think certainly something needed to be done to soak up the critically ill patients. There certainly wouldn't have been enough room for them in NHS hospitals, even though our local hospitals have stopped all routine care. They've stopped routine surgery. So there were post-surgical beds, for example. Anaesthetists were freed up who would normally be working in surgery rather than ITU. So there was room to free up, but it means that everything else isn't being done. So it means that there are people out there who are probably sitting on conditions longer than they should be sitting on them because of the pandemic. But I think that the sort of the running down of the beds, and we've seen it has been going on for a very long time, and to a certain extent, as people need to stay in hospital for shorter amounts of time, as day case surgery has increased in use, you don't need as many beds for people to stay in as we did maybe sort of 30, 40 years ago. But lately, hospitals have been operating way above the 85% safe limit, which they were supposed to, there's supposed to be enough slack in the system so that if something happens, we've got slack in the system. And hospitals locally have been operating 95, 96% capacity, and so there's no slack at all. And then, of course, there are 100,000 staff vacancies in the NHS.
Really?
So, yes. So they might, they can open the Excel and they can do that, but then do they have the people there to staff it? So
I was surprised. I saw the small print in a news story the other day that said, the government's done really well opening whatever it is, however many Nightingale hospitals around the country, but they're not providing any extra staff. So all of these extra hospitals have to be staffed by the existing staff who are so overworked in the hospitals that we've got. So that seemed to me a bit of a mismatch.
And that's exactly the case, and that's exactly what's happened. And staff have had to be deployed, and other staff have come back to work. So lots of retired people have volunteered to come back to work. That's been another fiasco, because in fact a lot of them have volunteered to come back to work to help out, and then it's just taken Capita a very long time to process them, and a lot of people have waited 3 or 4 weeks and still heard nothing.
Why is Capita involved? What have they got?
Capita are a private company who the NHS outsource a lot of their administrative sort of tasks to, and have done for quite some time now. They've been previous fiascos with them. I mean, people might remember there was a fiasco with the cervical smears a year or so ago, and also losing loads of medical records and so on in warehouses.
Yes, they haven't got a good reputation, Capita, have they? I didn't realise it was that widespread, the outsourcing. Obviously, that's what campaigners mean, isn't it, when they talk about the NHS being privatised? It's not sold off as a package, it's just all the individual functions being carved up and sold off to different people. So but nonetheless, even though the personnel haven't been provided, I'm wondering what we should do about Excel now. I know there are lots of people who had jobs there as part of the exhibitions that used to run there, but I'm wondering if now that it's been sort of set out as a hospital, if we shouldn't keep it that way for a while and try to use that as a facility to cut down the backlog. Would that be practical? Would that be a good thing to demand?
I don't know what sort of surgical facilities and things they've got. So I don't know whether they're set up to carry out sort of planned surgical operations and things. I don't know if they can do that, but I certainly don't think it should be stood down yet, because we don't know what's going to happen with the virus. We don't know if it's going to disappear. We don't know whether it's going to, when lockdown is over, whether it's going to start circulating and whether we're going to get another peak.
Yes.
So I think, we just don't know enough about this virus, and we have to keep the planning in place for it. But we should also make sure that we're not abandoning everybody else with all of their other illnesses. I think that's really important.
Yes. Well, a few weeks ago, we were talking on this programme to Tom, who's a homeless campaigner, and we were saying, if they can maybe, if they can build this unit so quickly, then they could end homelessness very quickly as well. But this is probably going to be a very gradual move to back to onwards to the new normal. So Okay, so that's the sort of the technical side of things. We've all been clapping for the NHS, but I know your latest newsletter from Tower Hamlets Keep Our NHS Public has said that we need to do more. And it's listed a number of things. I mean, what do you think, what else can the public do? What else needs doing to the NHS to keep it all going?
I think it's fantastic that the public are coming out every Thursday to clap. It's really heartwarming, and I'll never forget the first time I heard it. The first day it happened, I was sitting inside and I could hear this noise. It's like a Mexican wave. It was incredible, and I just hadn't expected that at all, and neither had my colleagues. But I think the public also need to get behind NHS and social care workers, because social care workers are the forgotten people in all of this, and they are looking after the elderly in care homes, and they're even less protected than we are. But I think the public need to get behind us and demand from the government that actually they protect us properly, and they stop, quite frankly, telling lies about what's happening. And the government keeps saying we have enough PPE, personal protective equipment, and what we have is adequate and appropriate. And it just isn't, and we don't. And we have times when we're running really low. We have times when, as I was saying earlier, whereas the masks aren't right. We've only just started getting visors. With weeks and weeks we didn't have those. We haven't got any long sleeve gowns in general practice in Tower Hamlets. We've just got sort of plastic aprons. And social care workers in particular are having to work really intimately with their clients and get really up close and personal. They can't be 2 meters away. It's just not possible. So I think the public, it's easy to look at the NHS and think not much of it's changed. Unless you work in it, you quite often don't realise that it has, because to the public it might look a bit like it always has done. I mean, the service might not be quite as quick, or premises might not look quite so well decorated, but the privatisation that's going on sort of below the radar is rapacious and unrelenting. And I think the public need to understand that. They need to not be taken in by what the government say. The NHS is being privatised, it's being removed, it's being taken away, and the public really need to get behind us and to help us to campaign to restore the NHS to as Nye Bevan intended it in 1948. For everybody, free at the point of delivery, and publicly funded and publicly provided. And I think that publicly provided and publicly funded are really important concepts.
What can we do practically to help, Jackie? Because I think a lot of people now would like to help, but they just don't quite know what to do.
Okay, well, people can do all sorts of things. I mean, they can make sure they can be in touch with their MPs, they can write to their MPs, they can sign petitions, but when lockdown is finished, they can protest and they can look at, go to the Keep Our NHS Public website, get involved with your Keep Our NHS Public groups. There are Keep Our NHS Public groups all across the country, and some of us, some of them are quite big and very active, but some of them are run on about 3 or 4 or 5 people. We've got a great one in Tower Hamlets, and we also come together across North East London. But we need more people involved, really, because the more people that are involved, the more we can do, and the more we can achieve. And it's a great campaigning group, and I think campaigning helps people feel empowered as well, and that they're doing something and talking to like-minded people.
And it's not as if you need any experience, is it? I mean, often a cause like saving your local hospital or your GP service is often where people start a lifetime of political activism and feeling very tired. But yes, certainly we can all get involved, can't we? And you know what they say: if you want something doing, ask a busy woman. And I think if you ask a busy woman in the East End, you're even more likely to get it done. So, and I think it's very friendly. I mean, I wondered Tower Hamlets Keep Our NHS Public was part of a conference held a couple of months ago now on migrants using NHS facilities, and I wandered up and didn't particularly know anybody there, but then I found I did know quite a lot of people there, and it was all very, very friendly. So I think anybody who wanders along to a campaign meeting and says, I'd like to help save my hospital, and the NHS would be made to feel very, very welcome. So speaking of migrants, I think one of the things, the actual practical things going on at the moment is that migrant workers who are working in the NHS are having to pay some sort of premium for their families, if they're with them, to receive NHS care. That seems, contrary to the principles of the NHS, but also very short-sighted at a time when we've got a pandemic.
I mean, that came in 2015, and it's shocking, really, because, I mean, a lot of it's called the migrant surcharge, and it started off as being £400 for anybody coming into the country unless they were an EU citizen. But of course, with Brexit, then the EU citizens will also have to pay it to use the NHS, or £200 if you're a student, and then now it's gone up. And a lot of these people work in the NHS. So they're coming over and they're paying for the privilege of working in the NHS, and doctors, nurses, porters, cleaners, care workers. The NHS would fall over, and social care would fall over without migrant workers. So I think it's an insult to them, but also, yes, it's against the founding principles of the NHS, because the NHS was there to provide health care for everybody wherever they came from. And I think Nye Bevan, there's a quote, and he said, the NHS, he never intended overseas visitors or migrants to be charged for healthcare services, because how would you decide? How would you sort he said, the sheep from the goats? How would we all have to carry identification with us? And what became a nuisance? It would become a nuisance to all of us. So, and I think it's really important to understand, especially with COVID, that people, even though COVID is exempt from charging, and I'm moving on now to charging for healthcare, because again, there's upfront charging now for anyone from overseas if they need healthcare over here, unless it's an emergency. And some illnesses like TB are also exempt, but overseas migrants don't know that. It's all very confusing. So there are people who've died because they haven't sought healthcare for COVID, not understanding that they were exempt from. There was no charging for COVID, and also people worry about flagging themselves up to the Home Office if they present unwell. So the whole issue around charging migrants for healthcare, and of course, it's just once they start charging one group of people, it's just a hop and a skip to charging the rest of us. So it's not. I don't think we can all just sit back and say, oh, well, it's fine, charge them, they're nothing to do with me. I mean, I don't subscribe to that anyway. I don't think anyone should be charged. But even if that's what you do think, be sure that they'll be charging the rest of us soon.
That's always the way, isn't it?
Yeah.
And I was surprised, actually. I read, again, as a result of Tower Hamlets Comp's campaigning, I looked into this question of charging, and I read up on a report of the trial, the pilot that had been done in Newham, on charging for maternity services, and it sounded like a vast job creation program. I mean, certainly a lot of people who are born and bred in the UK and don't often leave it. You don't necessarily have a passport. You don't necessarily have all the documents, so it's very difficult to prove that you are who you are. I mean, I recently, a few years ago, went for a new job and had to produce my birth certificate, and I just stood there in the HR office saying, I have been born. Look, do I look like a fetus? Why do I need to prove that I've been born? So apparently there was some other greater purpose for having a birth certificate. So, so a lot of people, I think, are undocumented for good reason. But what I then found was, the people who turned up at newer maternity services and couldn't immediately prove that they were entitled to free NHS care had to be investigated by office workers. And fine, it just needed so many office workers, and at the end of the day, as the office workers found more and more people were in fact entitled to free care, the amount of money that these people could be invoiced who were not entitled ended up being tiny, and I'm sure it was less, the income was less than the expenditure on office workers. And I thought, what a stupid thing to do. But I'm sure they will say the pilot was a great success and move on. That's all written up on East London News if anybody wants to go there. So, and just one other thing that interested me, Jackie, was I think if you ask most people in Tower Hamlets, they say, oh, GPs, of course, that's a public service. But a lot of the GPs seem now to be in sort of hubs and owned by companies that I can't remember the names of. Or at least run by them. What's all that about? Are GPs, would you say Tower Hamlets GPs are a public service still?
Yeah, Yeah, I mean, because there are hubs as well. We've got general practice and we've got hubs, but the hubs are run by the GP Care Group, which is an umbrella organisation which brings us all together, really. So local GPs will work in the hubs. And at the moment, we've got the main hub now is in the Royal London, in Clinic 3 at the Royal London. But that is staffed by local GPs. And it's all run from the NHS budget. It's not... So certainly in Tower Hamlets, they're not run by private companies.
All right, good. Yeah, no, I was just worried because whenever I go into my GP, I get notices up saying the something group says do this, that, or the other.
That would be the GP Care Group, but they are an umbrella organisation for all of us.
Very complicated, yes.
Yeah, it is.
Right. Okay, well, hopefully we can stop any attempts at privatising the GP network. What would you say to the young people who are, let's say, people who are taking their GCSEs this year by teacher assessment rather than exams? Would a career in the NHS be something they could look at? I get a feeling that our young people don't really think about the job opportunities in this area.
No, I mean, I think working certainly as a GP is a fantastic privilege, and I've loved working as a GP, and the patient-facing side of it is an absolute privilege. And I think the NHS can be a fantastic place to work, and it's the biggest employer in Britain, isn't it? It's got over 1 million employees, and there are so many career opportunities. You don't have to be a clinician. You know, there's all sorts of other jobs that can take place in the NHS, but the NHS is an increasingly stressful place to work because of the cuts and because of the private, the incoming of the private sector. But I don't think that is a reason that people shouldn't work in the NHS. I think people should work in the NHS and have a very rewarding career, but then also join with us to fight to get it back to how it was intended to be, to restore it.
And those, there's just I just think the NHS doesn't get much of a look in the local sort of careers guidance, or in Tower Hamlets at least, although that's a service that was also being cut in recent years. I've met sort of 16-year-olds sort of say, "Oh, I've got my 5 GCSEs. What shall I do now?" And none of them seem to say, "Oh, I might consider training to be a nurse, or I might consider training to be a healthcare assistant." And it seems such a shame. It would be nice to think we could raise the profile of the NHS a little bit more, because I'm sure there are some people who would be very much at home there. Okay, Jackie, is there anything I haven't asked you that you'd like to talk about while you're with us?
I don't think so. I mean, I suppose I would just say, I'd appeal to the public really to throw their voice and their action in behind those of us who are campaigning for the NHS. Keep our NHS public, and really get involved, and don't let the precious institution that is the NHS be consigned to history. And I think we have to campaign, because if we don't, it will be. And I think we don't have to sit back and say, oh well, what can we do? This government is in for the next 4.5 years. We can do things which put pressure on them to stop decimating our NHS and social care, and we have to fight really hard for it.
Do you think that now Boris has been a benefactor from the NHS, has had his care in a National Health Hospital? Do you think he's a convert? Do you think he'll look after the NHS now?
I doubt it. I'm sure he'll have a short memory. I'm sure he'll have a very short memory. But interestingly, there is no private hospital that could have looked after him, because private hospitals don't have those facilities. They won't, because they don't make them a profit. It's not profitable to have somebody come through A&E and be on a ventilator, so private hospitals won't do that. But I would be very surprised if he was a convert. If he was a real convert, if he really was, he would show it by restoring the NHS pre-2012 Health and Social Care Act back to as it was in 1948.
And we haven't seen that at all, have we? All we've seen is hedging. Really, I'm just looking at your your latest newsletter. I'm sure there was something in there that the government wasn't being clear. Yes, this was one thing that I think your campaign's written about. Most NHS workers, or at least a good number of them, are employed directly by the NHS, but some are outsourced, particularly the porters, cleaners and support staff. And there's been a lot of concern that those people are not getting sick pay, and they're not getting coronavirus sick pay if they're having to isolate or something like that. And I think there was also a report, which I chased up yesterday, about a cleaner working in South London who said that they needed PPE to clean up in the hospital, and they were made subject to disciplinary action for demanding PPE. So is there a sort of divide between those who work directly for the NHS and those who are outsourced workers? And that must be a big factor in the London hospital with its PPI system. Yeah, well, the PFI is certainly the PFI, and there's PPI. That's something else.
No, very much so. And I mean, in the London, there was a strike about 2 or 3 years ago. I'll never forget. Time always goes more quickly than I think it does, so it might have been longer ago. With Serco, and the facilities staff in the Royal London Cross Parts Health were transferred to Serco, who then immediately cut their breaks, and so they went on strike. And this quite often this happens time and time again when health workers are transferred from being employed directly by the NHS. Then the NHS will outsource to a private company, and terms and conditions will be immediately a lot worse. A lot of them are on 0 hours contracts, and not necessarily locally, but lately a new vehicle that's been set up is something called a wholly owned subsidiary, which looks as if it's jointly owned by the NHS and a private company. But in fact, what happens is that workers are transferred across, and they can keep their NHS terms and conditions for a couple of years, but then they lose them. Yeah. And anybody new who's employed comes in on the private company's terms and conditions. There's a 2-tier workforce within. And it's just a way of eroding NHS terms and conditions. Yeah. And a lot of these people are some of the lowest paid people in the NHS, and they have very few rights.
Yes. I think you have to generally be very carefully of wholly owned joint things. They're a big problem in housing as well, which makes me think perhaps we should cover that subject shortly. Okay, I think that's it. I know you have to go off now to do join another Zoom event. So thank you very much for coming on today, Jackie. It's been a real treat to have such a knowledgeable campaigner, and obviously keep in touch. And as we go through the rest of this crisis, let us know if anything else comes up that people can do, and we'll continue to keep covering your activities on East London News and our other channels, and see what we can do to help people get in touch with you. So thanks very much, and I'll let you sign off.
Lovely, thank you, and thank you for having me.
Very welcome.
Bye-bye.
Bye-bye. And usually at this point, our guests find it very difficult to sign off, and you get people struggling to pull the plug on their system, but hopefully Jackie's been successful. Now, I just want to remind you to call in, and I know you're all very shy about calling in, but this is your forum where you can ask John Biggs a question. You can't ask him a question direct because he hasn't responded to our invitation to come and talk about Tower Rewards, the new pay system for people who work for Tower Hamlets Council. Tower Hamlets Unison came and talked to us last week, and we thought it was only fair to ask John Biggs to come and talk to us this week, but that hasn't actually happened. So, as I say, he's not responded to our invitation. So, do call us. You can call in to the studio on 0208 12345 07. Call in, and you can tell us what question you would like to ask John Biggs about Tower Rewards, or about what the council's doing about Corona, and we'll collect the questions and pass them on to him. Just while we're waiting to see if anybody would like to ring us in, I'll just go through the headlines, our East London headlines. Obviously today on a national level, everyone's talking about Boris being back at his desk. I don't know if that's a good thing or a bad thing, but we might get a bit more direction, although which direction it will be, we don't know. Today is Workers' Memorial Day, and when we remember those workers who died at their workplace, usually because of lack of health and safety. Early this morning there was a socially distanced rally, possibly the first one we've had in Tower Hamlets, outside the Royal London Hospital, remembering those NHS workers who have died during the corona crisis. So that's not very helpful, is it? I see that every time I click on my notes, I blank half the screen. So okay, so going on, what's happening across East London in Tower Hamlets, the council has announced that food and garden waste collections are going to resume on Monday. There's been a lack of some of those collections because of staff shortages because of the pandemic, so they haven't been going on. But they're going to start again from Monday. Hopefully staff are better now. And also Tower Hamlets has told its community groups they're going to be given 3 months rent-free. So that's supposed to soften any effect of the corona crisis. So that'll be good news for the community groups. So remember, you can phone in to speak to us if you like on 020 812 345 07. Going on to some of our other East London boroughs, Hackney has also launched a support package for its community and voluntary sector groups. And in other news, they've just announced that they're going to build 600 affordable homes in Woodbury Down. So they're being billed as genuinely affordable. So that can only be good. Although, again, even for Hackney, that's just a very small percentage of the number that we need. I think we are going to have to press ahead with this, keeping Excel open for homeless people. What's happening in Newham? Newham's news is very corona focused, with a weekly newsletter from Mayor Roxana Fiaz, which I think is quite interesting. If you remember, we used to have a weekly newspaper in Tower Hamlets to keep us all informed, and government had to intervene and stop that. But it's happening sort of online now in Newham, with Roxana Fiaz personally giving the borough's residents their corona news. And the thing that she's announced today is that 935 cases of coronavirus have now been detected in Newham. Another problem that Newham's facing is too many COVIDiots, they're being called now, people who are not respecting the lockdown and are going into the local parks. And Mayor Fiaz reminds us that, of course, with people not observing the lockdown, they can only be dealt with by the police. It's not a council job to enforce the lockdowns. They don't have the powers to do that. So if you are troubled with seeing a lot of people out congregating, you have to contact the police, and she recommends doing this via 101 or via the Twitter handles, which are available for all the local borough police forces, at MPS for Metropolitan Police Service, and then the name of the borough. Things seem to be getting a bit more positive the further out east you head. In Barking and Dagenham, £100,000 has been acquired by the council from the charity foundation, and that is a rapid response fund to fund some of the local activities to support people who are in difficulty because of corona, the pandemic. So that's got to be very positive. I don't know if any of the other boroughs have achieved funding. I know generally councils need more funding, but I don't know if other grants have been forthcoming. And in Redbridge has chosen to announce that 200,000 people have now visited the coronavirus hub on its website for information about what's going on locally. I don't know what's... see, if John Biggs had been here, we could have asked him how many people have visited the Tower Hamlets website. That's got a lot on about corona as well. Redbridge has also proudly announced that it has housed 80 rough sleepers to keep them safe off the streets and able to lock down in somewhat more safety since the pandemic began. And finally, Havering Council is working with Havering Mind, and they've launched a bereavement support phone service. So look on their website if you're in Havering and you feel that service would be useful, or if you're a councillor in another borough and you don't know whether your borough, your council, has a bereavement support line. Go and look on Havering's website and find out how they've done it. Now, I've been given a couple of things to ask from Tower Hamlets Unison, so I'm just looking down at them now. The question that Unison would like to know is, at the moment, the Executive Mayor of Tower Hamlets, John Biggs, intends to sack the entire council workforce on the 6th of July, and then to re-engage them on new terms and conditions. Unison say those terms and conditions are not as good for the majority of staff as their current employment. So why has John Biggs done this, and how can he justify doing that, as particularly at a time like this when the service that those staff offer is so critical and so helpful? As I say, John Biggs was invited to come on and tell us all about it, so we'll send him that question, and I'll let you know next week what he says. And the other thing we've got to look forward to, okay, we've had one virtual rally in Tower Hamlets already. That was the Workers' Memorial Day minute silence at 11 o'clock this morning in the rain outside the Royal London Hospital. But we're also coming up to May Day. In fact, it's going to be May Day, the 1st of May, on Friday. And that, again, is a day when a lot of... it's Workers' Day as well, when a lot of workers' rights and gains are commemorated. I don't know what the official line is, but I suspect that the usual May Day rally has been cancelled. But Tower Hamlets Unison, again, is going to hold a virtual rally. It's going to happen at 5:15 on Friday the 1st of May, and it's going to be a Zoom rally, and I can't read the meeting ID, it's far too small. Oh, I can make it bigger. The meeting ID is 921 0772 3224. So you can join that Zoom rally at 5:15 on Friday the 1st of May and listen to the speakers from Unison, the NEU, which is the Education Union, health workers, transport and postal workers, as a local MP, and also Matt Rack, who is the General Secretary of the Fire Brigades Union and used to live locally and used to work locally as well. So that's a roundup of the various news that we've had in. If you're representing or working in a campaign in East London, do let us have the information. I'm sorry that you've all been so shy that you haven't wanted to ring in today. I know that only some of our viewers watch us live, and we are at a new time, and a lot of our viewers catch up on our catch-up service later. So you can still contact us via the comments box in underneath the video on our Facebook page, on the Vodcast Facebook page, or you can always email me, jenny.fisher, at eastlondonnews.co.uk if you have a campaign that you'd like to promote, or if you'd like to come on air and tell us a little bit across East London about what's going on. So that all being said, I think we're done and dusted now. We will be coming on at 5 o'clock on a Tuesday during Ramadan, so please connect with us then. Tune in and keep yourself informed about what's happening across East London and feed into the programme as well. So with that, I'll just say thank you for watching. We'll see you next week at 5 o'clock, and goodbye.